Good day, my friends. It's Menopause Barbie, your Menopause Taylor, joining you yet again with some important information on menopause in general and on osteoporosis in particular. We've talked a lot about osteoporosis. Did you ever have any idea it was such a big topic with such devastating consequences if you don't know how to avoid it? Here we are at video number 227. And the osteoporosis unit began with video 196. In the previous 31 videos, I've taken you through a stepwise understanding of everything you need to know about osteoporosis to avoid it or to treat it. Osteoporosis is all of chapter 29 in my book, in both the first edition and the second edition. But today's video isn't in the book as a standalone topic. Today, I want to address the question of why aren't more women getting bone density tests, preventive therapy, or treatment for low bone mass. And I will really be putting it all into perspective for you. This is a very important video. Every woman should watch it. You know, sometimes we get caught up in the minutiae and we fail to see the forest for the trees, as they say. Well, this video represents the forest. The bottom line is that too few women are getting bone density tests, preventive therapy, or treatment for low bone mass. And this video will explain why. And that will enable you to ensure that you're not one of those women. What I'll do is use what you've already learned to walk you through all the reasons so many women are falling through the cracks. And a fall through the cracks of oversights on osteoporosis could result in a crack of your spine, hip, or wrist that cripples you for life. The very first reason so many women are falling through the cracks is because both women and professionals fail to acknowledge that estrogen loss equals bone loss. If just that one little fact were common knowledge, it could change everything. But instead of focusing on estrogen loss as a cause of bone loss, people are focusing on calcium. You've learned that calcium contributes to bone quality, not bone quantity. So inadequate calcium is not the culprit in causing osteoporosis. Inadequate estrogen is. Estrogen loss is. But everyone's so afraid of estrogen that they refuse to accept the fact that estrogen has some invaluable benefits for your bone. And as you've learned, nothing else even comes close to estrogen's role in ensuring normal bone quantity. So as long as people refuse to deal with the real problem causing osteoporosis in the first place, they will have to deal with the problem of women falling through the cracks. The second reason so many women are falling through the cracks is that women and professionals are ignoring the fact that estrogen loss at postmenopause causes rapid and drastic bone loss in the first 5 years of postmenopause. Now, this is that time in the early transition when you have a huge list of symptoms that make you absolutely miserable. Those symptoms are supposed to be a wake-up call to get you to do something to compensate for estrogen loss. But with women adopting the attitude of just toughing it out, they don't act on those symptoms. They're in denial about menopause in general, and they're fearful of HRT in particular. And unfortunately, the vast majority of women waste those first 5 years of rapid, drastic bone loss, failing to do anything that could prevent it. They delude themselves into believing that things that are incapable of preventing bone loss can do what estrogen can do. The things that are absolutely incapable of preventing bone loss like estrogen can include diet, weight-bearing exercise, calcium, and vitamin D. The third reason so many women are falling through the cracks is because there are no symptoms of bone loss. You have nary a clue that your bone is leaving your body in rapid, massive quantities. You feel fine. Some diseases produce no symptoms until a catastrophe occurs. Osteoporosis is one of them. We call this a silent disease. Well, it may be silent for a while, but boy, is it going to get loud with time. With all silent diseases, you cruise along until something really big happens. In the unit on heart attack, I taught you that high blood pressure is a silent disease. You don't know you have it until you have a stroke or drop dead of a heart attack. With osteoporosis, you feel fine until you fracture your spine, hip, or wrist from something that should never cause a fracture. We call these fractures fragility fractures. They constitute the fourth reason so many women are falling through the cracks. They are sudden, unexpected fractures, and women are uninformed about them. Most of the time, when you ask a woman how she fractured her spine, she will say, "I don't know." And that's because a fracture from osteoporosis does not require trauma. Most women fracture their spines by sneezing or coughing or shaking out a rug. They aren't falling off rooftops or out of trees. In fact, they aren't falling at all. And once you had a fragility fracture, you're at high risk for more. These fragility fractures do not heal well or at all because you have too little bone in the first place. And the result is that the majority of women are unable to live independently afterward. So that's why there's a bone density test called a DEXA scan that can tell you if you're losing bone. It will enable you to detect it early so that you can take steps to prevent further bone loss. But the guidelines for getting your first DEXA scan tell you to wait until you're 65 years old, and your doctor follows those guidelines. So does your insurance company. And that's the fifth reason so many women are falling through the cracks. They don't get their first bone density test until it's too late. All because the medical guidelines and your insurance limitations dictate doing so. So if you want to get one before age 65, you might have to pay for it. And you have to have this education to even know you need to get it before age 65. Because by age 65, you may very well have lost 25% or more of your bone. You may have already sustained a fracture. So the guidelines focus on diagnosing osteoporosis once you already have it. They do not focus on diagnosing bone loss before you have osteoporosis. And when you do have a DEXA scan, it gives you two scores. The T-score compares your bone density to that of a 30-year-old woman. The Z-score compares it to a woman of your own age and ethnicity. You can have a normal Z-score with a T-score that shows significant bone loss, and that leads to the sixth reason so many women are falling through the cracks. Your doctor may focus on your Z-score rather than on your T-score. And he may tell you that your bone density is normal when it isn't. Normal for a 65-year-old woman means that you've already lost around 25% of your bone. So instead of receiving treatment for bone loss, you'll receive the all clear until you fracture your spine, hip, or wrist. And the risk assessment tools for bone loss, like the FRAX, are no better. They too are focused on diagnosing bone loss when you've already lost enough to have full-blown osteoporosis. And that's the seventh reason so many women are falling through the cracks. The risk assessment tools for osteoporosis focus entirely on treating you once you're broken rather than on preventing bone loss and breakage in the first place. The eighth reason so many women are falling through the cracks is that both women and professionals are trying to use diet and lifestyle measures to accomplish much more than they can accomplish. Diet and lifestyle options fall into the realm of prevention of bone loss when your bone is still normal. They are not capable of serving the purpose of intervention or fixing of osteoporosis. You'll still lose bone rapidly despite all your good diet and lifestyle measures. The ninth reason so many women are falling through the cracks is that they are using vitamins and minerals incorrectly too. Calcium and vitamin D are for prevention of osteoporosis only when your bone quantity is still normal. They are not for the purpose of intervention or fixing. So women are under the delusion that as long as they're taking their calcium and vitamin D, they are treating osteoporosis or replacing bone. That is so inaccurate. It's a false sense of security. The 10th reason so many women are falling through the cracks is the most ridiculous of all. Even though this whole phenomenon of bone loss is due to estrogen loss, estrogen is not even designated for prevention or treatment of osteoporosis. Why not? Fear again. If women got estrogen replacement when they first lost their own estrogen, they would never lose bone in the first place. But instead of treating estrogen deficiency, just like any other hormone deficiency, and replacing it somehow, estrogen has become demonized as being bad for you. You loved the way you looked and felt when you had estrogen. You hate the way you look and feel when you lose estrogen. Your bones were dense and healthy when you had estrogen, and you get osteoporosis and fractures when you lose estrogen. All studies of estrogen's effect on bone have always shown that estrogen replacement prevents bone loss. And yet, women believe that estrogen is bad for them. Until people acknowledge the beneficial effects of estrogen on bone, the situation will never change. The 11th reason so many women are falling through the cracks is because most women are unaware of the other hormonal medication options available for treating bone loss, and most doctors are too. And even if a doctor is familiar with them, they rarely offer them. It's as if the word hormone has become a bad word regardless of what kind of hormone it is. The 12th reason so many women are falling through the cracks is that they are unaware of all the non-hormonal treatments to prevent or replace bone loss. And so are most doctors who are not menopause experts. There's a whole smorgasbord of options, yet the majority of women have never even heard of them. Most of them are SERMs, and they can do for your bone what estrogen does for your bone: prevent bone loss or replace bone loss. And the 13th reason so many women are falling through the cracks is that even if women or professionals have heard of these hormonal or non-hormonal medications, the treatment guidelines for utilizing them indicate waiting until you have full-blown osteoporosis or a fracture. Although it would make so much more sense to use them for early osteopenia before you have frank osteoporosis or fracture, the treatment guidelines and your insurance dictate waiting until you need fixing. So these guidelines end up being a last-ditch effort. Did you see how not one single factor in this series of events focuses on avoiding osteoporosis in the first place? It's a vicious cycle designed to ensure that you end up with osteoporosis or a fracture. Here you see osteoporosis and fractures in the center circle. And all around it, you see each of the other items I listed as a contributing factor. There is just no excuse for this. It shouldn't be this way. There are so many opportunities to prevent osteoporosis in the first place, but the current state of affairs is sabotaging every single one of them. Here's how it should be. First, you should have an education that teaches you that estrogen loss equals bone loss. Second, you should be prepared for rapid and drastic bone loss in your first 5 years of postmenopause. Third and fourth, you should know that you will have no symptoms of bone loss and that the first sign will be a fragility fracture. Fifth, you should get your first DEXA scan when you first become postmenopausal and then regularly thereafter to diagnose bone loss early. Sixth, your doctor should be required to tell you your T-score and ignore the Z-score altogether. So you'd be comparing your current bone density to the best it ever was. Seventh, if your doctor uses a risk assessment tool, it should be for purposes of prescribing treatment for early intervention rather than for last resort options. That way you could utilize the diet, lifestyle, vitamin, and mineral options for prevention, which would be number 8 and 9. Or 10th, you could start estrogen replacement before you lose bone, as well as for intervention or treatment of bone loss. Alternatively, 11th, you could use another hormonal medication option for treatment. Or 12th, you could use a non-hormonal medication for early osteopenia long before you have full-blown osteoporosis or fracture. And 13th, the guidelines for treatment should focus on early treatment for early bone loss so that women don't find themselves in osteoporosis land or fracture land. If this were the case, our cycle would look a bit different. This is a cycle of how it should be, and it includes none of the drama of the way it currently is. You could actually reduce it to something as simple as this. So here's a summarized list of all the pitfalls that have created the current disastrous osteoporosis situation for women. As you can see, this education is your powerhouse of options to avoid falling into the cracks. The pitfalls are at every turn, and it's up to you to do what you have to do in order to avoid them. The bottom line is that osteoporosis is entirely preventable, but that's not the way it is being managed by women or by professionals. That's where I'll stop today. Next week, we'll focus on the fact that not all options for preventing osteoporosis provide the same benefits. We have only 3 more osteoporosis videos. So I will see you next week. For scheduling a consultation, go to menopausetailor.me. Be sure to subscribe and follow me on Facebook, Twitter, and Instagram. Bye!